juices from the pancreas, they escape into the peritoneum or into the abdomen, and from there they go into circulation and they start causing inflammatory changes in the lungs and in the kidneys and so on. There is no role for immediate surgery. You have to stabilize the patient. Sometimes the patients respond to medical treatment in the ICU, which is very intensive treatment. But sometimes they need surgery.
You are watching Surgery Simplified, shastrakalasaralshabdomein.
Hello, namaste. Welcome back to our channel, Surgery Simplified, shastrakalasaralshabdomein. मेरे साथ हैं डॉक्टर निखिल बलजेकर.
नमस्ते.
So, व्यूवर्स को थोड़ा सा रिवाइंड करते हैं. पिछले एपिसोड में हमने डिस्कस किया था कंडीशंस ऑफ एक्यूट एब्डोमेन, अपेंडिक्स के बारे में, गॉल ब्लैडर डिजीज़ के बारे में और किडनी स्टोन के बारे में. Are there any different kinds as well?
Well, acute abdomen, as we discussed, it is a surgical emergency.
Right.
Now, the conditions which I discussed till now as a part of surgical emergencies are based on the frequency with which we see the patients. That is one. And secondly, these three conditions by and large do not have an effect on possibility of death. That means amongst the conditions of surgical emergency, these are less chance of killing a patient. Now the conditions which I am going to discuss are all potentially fatal conditions.
Okay.
So if they are not treated really very quickly, you can end up with the patient dying.
Oh, okay.
So what are these conditions? I would like to list them out first.
Sure.
One is pancreatitis. I'll be explaining what it is. Second is intestinal obstruction. The third is hole in the intestine, what we call perforation with peritonitis. And the fourth is, which is very specific to ladies, which is known as rupture of ectopic pregnancy. These are the four conditions which I would like to now discuss over the next few episodes. Which are potentially life-threatening if not operated in the immediate period. Okay. Now let's start with pancreatitis. So what is pancreas? All know that there is something called insulin in the body. This is the organ in which insulin is produced. Okay, where does it lie? It actually lies across the abdomen, from the right to the left, across the spine, behind the stomach. Okay, behind the stomach, and it produces juices which help in digestion of food, but it also produces many hormones. One amongst them is insulin, which controls blood sugar, but it has function of many other hormones also, which we at the moment don't need to go into. Okay. Now the location of the pancreas is that it is like a gland, multiple glands, like your salivary gland. It is like multiple glands entering into, like how you have a bunch of grapes. If you see a bunch of grapes, each grape will have a small stalk, and it is attached to the main stalk.
Right.
So this is called as a compound racemose gland in our language. Compound racemose gland is something like a bunch of grapes. It's the same architecture even in the breast. So you have one gland with one duct entering into another duct which enters into a main duct. So it's like that. So the structure of the pancreas is very similar to the salivary gland. It produces enteric juices which help in the digestion of food other than hormones. Now the main duct of the pancreas comes exactly where the main duct of the bile duct comes, and they open through a common duct into the duodenum, the second part of the duodenum, and therefore the pancreatic duct is also accessible to the endoscope, like the bile duct. So now many times when there is a stone stuck in the bile duct, because the two ducts are very near to each other, the pressure can cause blockage of the pancreatic duct and it can lead to pancreatitis. That means blockage of the duct allows prevents the juice from coming out. So it builds up pressure inside the pancreas, and the pancreatic juice, which is supposed to digest food, starts then spilling out and starts digesting the normal intestine of the person. So you can imagine what serious condition it is. So this condition is called pancreatitis.
Okay.
Now what are the causes of pancreatitis? If you remember the alphabet A, B, C, D, E, it's very easy to understand. A, alcohol. Alcohol is one of the common causes of pancreatitis. Especially if a person drinks over a, binge drinking, a lot of drinking, like say New Year's Eve, you drink a lot, or some celebration, you drink a lot suddenly. So that, alcohol. Second, B is biliary disease. Gallstones which come down into the common bile duct will obstruct the pancreatic duct and lead to pancreatitis. So B is for biliary stones. C, I have labeled it as COVID, because in COVID a lot of people also got pancreatitis and died.
Okay.
I have operated 1 or 2 patients who survived from that pancreatitis and needed surgery, initial pancreatitis. But basically it is RNA virus. So instead of, because C is easier to remember, so I have said COVID, but basically it is viral pancreatitis. COVID was also virus, therefore some people who had COVID also had viral pancreatitis. That is the same virus which caused COVID also caused pancreatitis. Now this is the commonest cause or common cause of pancreatitis in children. And it's generally fatal. I have seen 1 or 2 children with viral pancreatitis I could not save.
Oh.
Yes. Then D is drugs. Some medicines which are used, for example, in chemotherapy, in the treatment of cancer, some of these cancer treating drugs can cause drug induced pancreatitis. Okay. And E is for endocrine conditions. E is endocrine, means now diabetes is an endocrine condition. It is one system called endocrine system, where endocrine glands such as the thyroid, pancreas, adrenal, they secrete hormones. So endocrine conditions, so certain diseases like hyperparathyroidism is a disease. There is a parathyroid gland near the thyroid which controls calcium metabolism. So illnesses of the parathyroid gland can lead to pancreatitis. And then after that there are miscellaneous conditions like seat belt injury. You are going in a car and then you hit something. Your seat belt can injure across your abdomen and it can injure the pancreas. Okay, it's not as a seat belt injury which can lead to traumatic pancreatitis. Okay, so these are conditions which cause pancreatitis. But what is the reason why pancreatitis is deadly? First of all, it is difficult to diagnose. Okay, because it is way behind the stomach. It's more towards the back end of the body, near to the spine, rather than in the front. So the symptoms don't appear so dramatically in the beginning, which is the time when actually if you start treatment, you can save patients. The second thing is that it very quickly spreads into systemic problem. Just like COVID, what was COVID doing? It was causing a systemic inflammation syndrome, which is called as SIRS, systemic inflammatory syndrome. Okay, so same thing happens here. The juices from the pancreas, they escape into the peritoneum or into the abdomen, and from there they go into circulation and they start causing inflammatory changes in the lungs and in the kidneys and so on. So very quickly the person who has pancreatitis goes into what is known as MODS, that is multi-organ dysfunction syndrome. Okay. Now it is easy to diagnose this. Once you know that you are suspecting pancreatitis, there is a blood test which you can do, amylase and lipase, which is raised a lot, and you can do a CT scan which will show pancreatitis. Pancreatitis needs to be treated in ICU.
Okay.
There is no role for immediate surgery. You have to stabilize the patient. Sometimes the patients respond to medical treatment in the ICU, which is very intensive treatment. But sometimes they need surgery, because if they go into what is called necrotizing pancreatitis, that means gangrene, pancreas become gangrenous. It starts, सड़ने लगता है, that is the exact word, then you need to go and remove all that. And there then the mortality is above 40 to 50% when you have to operate for a case of pancreatitis.
Okay.
So pancreatitis is a dangerous disease. If you have severe pain and you know that you have taken alcohol or you have got gallbladder disease, you must go to the hospital as early as possible. That is the take home message of this episode. Do not sit on pancreatitis. Now some people ask that everybody drinks, why only I got pancreatitis? Again GOK, God only knows. There are some people who are particularly vulnerable. It's not that every person who drinks gets cirrhosis of the liver, right? But many people who have cirrhosis of the liver drink.
Right.
So the same way, pancreatitis also, most people who drink, I mean those who get pancreatitis because of alcohol will have to have taken alcohol.
Correct.
And A and B account for at least 80% of the cases of pancreatitis. Alcohol and biliary disease, 80%.
Okay.
Yeah. And those patients who have got pancreatic disease because of gallbladder disease, once the pancreatitis is settled, you have to go and remove the gallbladder anyway. So this is in brief about a very dangerous condition which is called pancreatitis. Take home message is any pain which is very severe, especially going from the front to the back.
From the heart section.
Yes, from the front, this is known as the epigastrium, just below the heart, from here to the back. The pain starts here but goes towards the back.
Okay.
That kind of pain is a pain of pancreatitis. It is associated with person being very sick. Generally there will be vomiting also. This kind of symptom complex should go and consult a doctor and be prepared to be admitted in the ICU.
Okay.
Yeah.
Alright. Thank you so much for the valuable information, doctor. So that was all about pancreatitis. Those are hard names to remember, but thank you so much. So that was all about this special information about one of the many conditions that are
potentially
fatal. Yes. So
Yeah.
you will have to be very careful, and if you find any symptom that doctor has just mentioned, be sure that you consult your own doctor.
Especially if you have had alcohol or you suffer from gallstones.
Absolutely. So hope this was even more informative, and if you have any questions regarding this episode, please let us know in the comment section below. If you like this, please hit that bell icon for notifications, subscribe to our channel and like our video and share, and stay tuned for more episodes. Thank you so much.